One of the more tragic stories to come out after the Supreme Court overturned Roe versus Wade involves a 10-year-old Ohio girl forced to travel to Indiana for an abortion after allegedly being raped by a family member. Even though that family member has now been charged with the crime, the Indiana Attorney General, Todd Rokita, seems to be suggesting that the real villain of the story is actually the doctor who performed the abortion. But Rokita has now been served with a cease and desist letter from the doctor's lawyers. This comes after he went on Fox News and suggested that the doctor didn't report the abortion to the state. By the way, NBC News has obtained a copy of the report the doctor filed with the state of Indiana that spelled out the medical necessity for the abortion. I want to bring in Jennifer Welch now. She's the president and CEO of Planned Parenthood in Illinois. Welcome. This case is far from an isolated example. The Columbus Dispatch reports there were 52 abortions performed on children 15 and under in Ohio in 2020, nationally in 2017. The latest year we have the numbers on, there were more than 4,500 pregnancies reported in girls under 15. About half of those ended in abortion. How is Planned Parenthood approaching cases involving these young girls as they try to protect access to abortion?
We are approaching these cases, as we do all of our cases, by putting the patient at the center of care. And I think it's important to note that this example, this Ohio and Indiana case reminds us that if all of these bans and restrictions on abortion were really about protecting children, this young rape survivor would be better protected by the law. She wouldn't have been forced to travel to another state. And the doctor who performed care that was safe and legal in her state wouldn't be getting harassed by the legal head of the state. So this is a lesson that abortion providers across the country are not surprised by, but we're really constantly disappointed in what the legal system and the political system is doing to patients all over the country.
It's interesting. Your organization, Planned Parenthood in Illinois, are teaming up with Planned Parenthood in Wisconsin to make sure that women in that state can still have access to abortions in your state where it remains legal. So tell us a little bit about what you have going on there and how will this partnership actually work?
Well, it started already. As a matter of fact, when the Supreme Court overruled Roe v. Wade just 3 weeks ago, there were patients in the waiting room at Wisconsin health centers, patients who were then sent home and had to very quickly get a care at an Illinois health center. What we did in 2020 is we opened a health center in Waukegan, which is near the Wisconsin border. And we did that because we knew that patients would soon have no access to care in their home state of Wisconsin. And now we have medical professionals, doctors, nurses, medical assistants who work at Planned Parenthood of Wisconsin coming to Illinois, to our Waukegan Health Center to provide care. So we have both affiliates, that's what we call them in the Planned Parenthood, our neighboring affiliates, working closely together for patients who are forced to travel for care.
Do you see this arrangement as a blueprint for other states? Is the goal to sort of set up these partnerships among the states that can help each other out?
Yes, I think it gives us an opportunity to provide care to patients no matter what their zip code. And that's really what Planned Parenthood is all about. We don't believe that patients' care should depend on who they are or where they live. So we are open to these sorts of partnerships wherever it can help increase access to care.
Jennifer Welch, thank you very much for being with us. After the break, a bizarre sibling tattoo making waves online. We'll talk about it with our two iconic guests in the Culture Corner. Next.